Good afternoon. I am Dr. Priyanka Alurkar. I am a radiation oncologist in Apollo CBCC Cancer Care, Ahmedabad. I have done my MD in radiation oncology from Manipal, and after that I have worked in Hinduja Hospital, Bombay, and after that I shifted to Ahmedabad. My particular areas of interest are head and neck cancers and other solid tumors like breast and pelvic malignancies. Cancer, the word itself, is a very big shock for the patient, right from cancer diagnosis till the patient completes his or her treatment. So the commonly faced difficulties in our clinical practice are patients have a lot of financial issues. Even if they have money, they are not willing to spend it for someone who they know is going to pass away even after doing so much in the treatment. And also sometimes we have patients who are unaware of the diagnosis. The relatives don't want us to tell the patients the diagnosis, and still we have to go ahead with treating such patients. So it is very difficult to explain the patient and counsel them for undergoing the treatment. Of course it affects us a lot personally. Going back home after work, it stays in our minds for a long time, particularly in pediatric age group patients. Explaining the parents about the patient's diagnosis and the prognosis is very difficult sometimes. It is really challenging to face the parents' questions. We have to stay positive and we have to support the patient, but at the same time not give them false hope. That is the biggest challenge in our practice. So cancer diagnosis and treatment itself is as you call it, a battle, because patient initially is in denial. He or she is not able to accept that he or she has cancer. Undergoing treatment, the toxicities, the side effects of treatment, they have a lot of implications on the patient as well as the caregivers' lives. Patients are worried about monetary issues, disfigurement like hair loss, weight loss, pain, dependency on their relatives. So considering all these things and all the difficulties that the patient has to undergo mentally, emotionally as well as physically, when the patient is free of cancer and finally walks out of our OPD cancer free, it is very, very satisfying and very gratifying when the patient and the patient relatives come to you and thank you for curing them and freeing them of the cancer. Also, in many situations, sometimes we know that the patient cannot be cured of cancer, but all we can do is add a few more months or years to their life, and patients and their relatives are very grateful for that itself. So that is also again very satisfying. So about 1 year back, I had treated a small girl about 12 years old who had a brain tumor, and she was an extremely brilliant and extremely smart child, very good in her academics at school, good memory and very talkative child. She had a bad prognosis because brain tumors generally don't do well, and the parents were aware of that. So while we were having a chat with the girl, I asked her, what do you want to become in future? So she told me, I want to become a fashion designer, but I know I will not live that long. So that was really disturbing for me. But it has been 1 year after she has been treated with radiation therapy. Her mother sometimes keeps updating me with her follow-up scans and reports. Right now, touch wood, she is still doing well. So that is really satisfying for me that she has been cured of cancer till now and she is doing well till now.